Okay, so I think we're probably safe to get started now. So first of all, hello and thank you for joining us. It's our first ever webinar event. As it is our first, you might need to bear with us if we have any technical issues, but hopefully it's going smoothly so far. Obviously, we would normally invite you into our clinic for these events, but due to COVID-19, we've decided to take our events online, and you get the advantage of joining from the comfort of your own home, which is great. Just a little bit of housekeeping. The presentation with our in-house expert Alison will last for around 30 minutes. And as soon as that's finished, we'll move on to Q&As, and that will be with Alison. The Q&A option should be available throughout the presentation, so you can submit any questions that crop up while we're presenting and they'll get answered at the end. If for any reason you get cut out of the webinar at all, just please email me. It's dora@epsomskinclinics.com, and I'll just try my best to get you back in. Okay, so that's it from me for now, and I'll pass you over to Alison.
Thanks very much, Dora.
Okay.
Okay, so we're here to talk about the BTL Emsella. It's a piece of equipment that we got just before lockdown, but unfortunately, because of the COVID-19 precautions, we weren't able to start using it. So we started using it since we returned, and we're getting some very interesting people and cases coming to see us. So I just want to tell you about it and how it could possibly help you. So my name's Alison Young. I've been involved in the clinic ever since it started, and my family work in the clinic. But I'm a retired nurse. I used to work in gynecology as a ward sister. And so in my normal life, I was very much in contact with people who had problems with their urinary tract system. So it's something that when we bought the chair, I felt that I could really happily get involved in. Why Emsella? Well, EM stands for electromagnetic technology, and sella means chair in Latin, because that's exactly what it is. It's an electromagnet in the middle of a chair. It's a brand new technology, and it's not been around for very long, probably about 18 months to 2 years it's been available, but it's a real breakthrough for the treatment of incontinence. And at the moment, we're the only provider offering this kind of treatment in Surrey. There are others in London and others throughout the country, but we're the only one offering it in Surrey. The BTL Emsella works on the principle of high intensity focused electromagnetic technology. Sounds very, very posh, doesn't it? But basically, it's just an extremely powerful, focused electromagnetic field. And it allows the chair to put pulses into your muscles so that it actually contracts much more fiercely than you would ever be able to do. And you just sit comfortably on the chair. Not in the way that the model is sitting on this chair with your legs crossed and looking terribly, terribly relaxed. You do have to sit firmly on the chair and sit up straight. It's indicated for pelvic floor muscle strengthening and for the treatment of urinary incontinence. It's licensed for use in incontinence treatment in Europe, USA, Canada and Brazil, and other countries are seeking licensing at the moment. We've found a lot of good results from it, and it's backed by the science. This is a professor in Michigan, USA, and a doctor from Liverpool, both saying that scientific research has shown that 95% of treated patients reported a significant improvement in their quality of life. And that's a very high percentage. The benefits for you as a patient: you don't have to get undressed, you remain completely fully clothed. We do recommend that you wear something that's loose fitting and easy to sit in. It's totally non-invasive, and it's a walk-in, walk-out procedure. You'd come in the clinic, have your temperature taken and do all the usual things for COVID-19, but then you'd just be able to be shown into the Emsella room, and then for 28 minutes, you'll sit on the chair and experience a very strange sensation, but nothing painful at all. There's been huge demands over the last few years seeking some kind of procedure for female problems, and it's grown by about 20%, 27% every year. And incontinence represents one of the most concerning female intimate health problems. Over 19 million US women and 200 million people worldwide are affected by incontinence. And 5 out of 10 of these do not seek help at all, but those who do wait about 6.5 years before they seek any help. The market for incontinence has grown enormously. If, like me, your husband actually quakes every time he sees a feminine advert on the television, you'll know just how much it happens. But there's about £700 per year spent on adult incontinence products per patient. 128 billion adult incontinence products sold globally in 2010, and that increased to 18.5 billion in 2015, and it's expected to grow to 25.8 billion this year. And we see for ourselves that pads and pants and all sorts of things like that are forever being advertised, and for very good reason. So what is urinary incontinence? Well, urinary incontinence is the involuntary leakage of urine, mainly caused by aging, pregnancy, vaginal delivery, the menopause. It's most common in postpartum and postmenopausal women, and they are the largest population who will experience it. But basically, the muscles become slack, and therefore you can't actually hold the urine in. There are two types, particularly, of urinary incontinence. Stress incontinence is associated with activities that increase intra-abdominal pressure. So you've got a slightly full bladder, and you cough, sneeze, laugh, jump on a trampoline, go for a run, and you get a leakage of urine, which may be a tiny amount or it may be a significant amount. Urge incontinence is that involuntary loss of urine when you have a strong need to go to the loo. So you're sitting there absolutely desperate, you get up, you need to go, and you can't hold it. Mixed urine incontinence involves symptoms of both. You can have one or the other without the other one. So if you have stress incontinence, you don't necessarily have urge incontinence, but a lot of people suffer from both. According to the National Association for Continence, women with undiagnosed incontinence report a loss of confidence and a loss of intimacy. And this is about 50% of the time. And we know that you go out for shopping and you have to look for the loo because you know that you're not going to be able to wait to go. And certainly a loss of intimacy in 45% of cases could be caused by the fact that someone is worried that there'll be some leakage of urine. So what's the science behind it? Well, the pelvic floor muscles are the ones that control continence. They're the muscles that sit across the bottom of your pelvis. Body aging, childbirth, and the menopause contribute to those pelvic floor muscles deconditioning. They become slack, they become loose, and then you develop some incontinence. To effectively treat incontinence, you need to re-educate the pelvic floor muscles. Over the years, doctors, gynecologists have tried to put in prostheses and various forms of slings in order to pull those muscles up, and each of them has not really been successful. And there's been a lot in the news recently about them causing problems for women. So at the moment, if you were to be referred for treatment for incontinence, the gynecologist and the urologist would not really be able to offer anything very much other than just tablets. But this will help to re-educate the pelvic floor. It uses a high-intensity focused electromagnetic technology, which causes stimulation of those deep pelvic floor muscles. It's focused on the pelvic floor, and it stimulates the entire pelvic floor. And a single session can bring thousands of very, very powerful pelvic floor muscle contractions that are really important if you're going to re-educate those muscles. You may know about Kegel exercises or pelvic floor muscle exercises. Well, this little graph on the left-hand side shows how much you're likely to contract the muscles if you do a Kegel exercise. If the BT Emsella does it for you, then obviously it's much, much, much more powerful. And we think it's probably in terms of about 1,000 times more powerful. You could never, ever do it yourself. So what would you need to have? The course is 6 treatments. They're scheduled at least twice a week, but each treatment has to be separated by a full 24 hours. So you could have them Monday and Wednesday, you could have them Thursday and Friday, Thursday and Saturday, but you can't have them on 2 consecutive days. We actually recommend in the clinic for the best possible treatment that you have 3 a week. So have Monday, Wednesday, Friday. And that seems from the clients who've already been undergone this treatment to work very, very well. We'll then have a 3-month follow-up appointment to discuss how you feel after the treatment, whether or not you've had any improvement, whether it's what you expected. The actual treatment will continue as with any other kind of muscle toning. If you continue to exercise, so do the Kegel exercises, the pelvic floor muscle exercises, then you will continue to see some improvement. It's available to most people who suffer from urinary incontinence. There are 1 or 2 contraindications, but when we do our first consultation with you, we'll make sure that you don't have any of those contraindications. There have been several studies completed on this and a lot of papers written. There are others in progress and the BTL are actually running, and it's available for all types of urinary incontinence. And we've certainly found that 90% satisfaction, in fact, is even better in the clients that have already had the treatment at our clinic. The cost. A consultation with me to assess whether or not you're suitable is absolutely free. And we'll do it over the telephone, or we can do it by video phone if you prefer, but you don't have to come into the clinic for that. The 6 treatments, and it's a course of treatments, scheduled at least twice a week, possibly 3 times a week, is £1,650. If you need a secondary course, and just sometimes people with severe problems will find they get a good bit of improvement, but they'd like to see further improvement, and there's a 50% reduction on that. If after 3 months we feel that you could have some maintenance treatment or you feel you require it, then there's a 20% reduction on the cost of the full course. At the moment, we've got a discount to £1,500 for the first 10 clients who come to us. We've got 4 of those remaining at the moment, so get in quickly and you'll save £150. Thank you very much for joining us, and it's now time for your questions.
Great, thank you very much, Alison. So our first question here is, can you have this treatment as a man?
We've been asked that before, and BTL haven't done any particular trials on testing men, but the whole pelvis is different in a man. I see no reason why you couldn't have it if you've got a particular problem, but I don't think men get the same kind of problems as women do, unfortunately. They don't have children apart from anything else.
Perfect. Okay, and the next question is, what does the Emsella treatment feel like?
That's a good question. It feels weird. I've had a full set of the treatments myself. I don't want to make people undergo something that I haven't experienced myself. It's a little bit like a very, very mild electric shock, very, very mild. And it pulses, so you get a strange noise, and you get several pulses, and then it stops for a little while, and then you get some more pulses and it stops for a while. but it's a very peculiar feeling, nothing that you can really describe, but it's definitely not painful, just peculiar.
Great, okay. And another question here, when will I see the results of the treatment?
Most of the clients we've had so far have seen results after the second or third treatment, and those results continue up to the last of the 6 treatments. Some people haven't necessarily found an enormous improvement by the 6th treatment, but it actually does continue. And they have said that although they didn't feel after the 6th treatment that it had improved an awful lot, the improvement does continue, and it can be up to 3 months before you actually get the full effect from the treatment.
Right, okay. And our last question here is, are there any side effects from this?
No, there's absolutely no side effects. The only thing that would be a problem is if you have any metal implants near the pelvis, and therefore that's why we do the consultation to make sure that there's nothing that would contraindicate. You can't use your phone on it because otherwise it would wipe it. You probably, if you put your iPad down between your legs, it would wipe that. So the complications are to other pieces of technology rather than to your body, but no complications as far as we're aware.
Fantastic, brilliant. Thank you, Alison. So I think that was finished pretty quickly there. But I'll just let you know that if you do want to contact Alison directly, she has her own email address. It's Emsella, which is @epsomskinclinics.com. Or of course you can get in touch via our website and talk to our front of house team. So that's all from us today, and thank you very much for joining us for our first webinar. Take care.